Hello, and welcome to World Coma Day 2023. It is a pleasure to be here today to speak with you. My name is Denise Rhoney, and I'm a professor at the UNC Eshelman School of Pharmacy. I was one of the members sitting in the room the day that this initiative was developed, and it really is a pleasure to now be a speaker on World Coma Day and talk with you for a few minutes about the evolution and roles of pharmacists in the Curing Coma campaign and also in the care of patients with coma. We look at the Curing Coma campaign, it really is a bold initiative that takes a very holistic view of coma. This is the framework for the campaign, and you can see it's very complex and very complete. When we take a look at pharmacists, we can see that they are crucial team members across the continuity of care as a member of the multidisciplinary patient care team, our focus on comprehensive medication management, which is crucial in the care of patients with alterations in consciousness, to playing a role in education for patient, caregiver, and health professionals, and also developing the significant gaps and understanding those gaps in medical interventions and describing the medication therapy problems that might be experienced by these patients. And then also a member of the research team. So you can see all of these roles fit across both the modules and working groups within this Curing Coma campaign. So what I want to do is take a look at the past, present, and future roles of pharmacists and how we've evolved into an essential team member in the care of these patients. If you take a look at the evolution of neurocritical care pharmacists, you can see it very much started with just pharmacists rounding on general ward teams. This evolved then to just general critical care patients. And then with time, as a result actually of research and identifying that not all medications were optimized in these patients with neurologic illness, pharmacists began rounding with neurosurgery. As the discipline of neurointensive care evolved, you can see a great increase in the amount of pharmacists that are now practicing within this unit with the neurotensivist as part of the neurocritical care team. Research has been the foundation of our role. We have played roles initially first looking at optimizing anti-seizure drugs, and then ranging then to also pharmacokinetic analysis, to actual drug product development, and then lots of studies showing the value and impact of the pharmacist in the care of patients. And certainly there have been several key publications that have established both us as essential care members of this multidisciplinary team, both from Society of Critical Care Medicine, the American College of Clinical Pharmacy, and also the Neurocritical Care Society, highlighted in the standards for neurologic critical care units pharmacist as an essential team member. We've also seen a growth of our expertise development from first postgraduate residency training to more fellowship training to more PharmD PhD training to then training within and postgraduate training and training more experts in this field with release of our PON series with NCS. So there have been great advancements since the 1950s with the role and the evolution of the role of pharmacists in this space, really centered around our aspects in patient care, research, and education. So where are we today? We look today, it really starts with the position paper that was released for critical care pharmacy services in 2020. Not all the recommendations are on here. You can see there are various different recommendations across these 5 big bucket areas. First and foremost is patient care, and this is where most of the recommendations lie. The pharmacists are an essential part of this interdisciplinary care team to provide comprehensive medication management, adverse drug event prevention for all ICU patients. Next is quality improvement. We are there to optimize safe medication use, and this involves pharmacists looking at the entire medication use process, whether it's rounding with the team to developing policies and procedures, guidelines, order sets, pathways. Pharmacists are key in quality improvement. Again, research and scholarship, also training and education of the future pharmacists in this space, and then also maintaining and developing our competencies within practice. A key aspect of what pharmacists do is around identification, prevention, and management of medication therapy problems. A medication therapy problem exists when the use or non use of a specific medication results in a less than optimal clinical outcome for the patient. This is a really key role for pharmacists to identify, prevent, and manage these in order to improve the health outcomes of our patients. They fall in four big bucket areas around an indication for the medication, effectiveness for the medication, safety of the medication, and then the last is adherence, or in the ICU, more patient specific factors and factors related specifically to the patient that might impact optimal outcome of the medication. Patients with altered consciousness can be highly vulnerable to medication therapy problems. Why is this? There's complex medication interventions that are used in the care. There's a use of a lot of high alert medications for these patients. There's also the potential for altered pharmacokinetics, or how the body handles the drug. We use a lot of off-label drug use. There's alterations in organ function that can fluctuate across the care continuum. And there's also multiple routes of drug administration. All of these place these patients at a higher risk for a medication therapy problem. So, what are some common interventions pharmacists might have in patients with coma? And this is not comprehensive, it's just to give you an example. We're very exquisitely involved in dosage optimization and trying to find the right dose, whether it's through therapeutic drug monitoring or ensuring we're using the right weight for dosing, and also evaluating drug interactions and the need to alter dosage because of drug interactions. Also, additional therapy needed. We play a critical role in chronic medication reconciliation to ensure we're starting back the right medications that patients may have been on prior to the illness. Adding additional preventative therapy, the need for synergistic therapy. We also stop unnecessary medication based on treatment duration or a patient having duplicated medications or duplicated classes. We also optimize the route of administration. It's really important for us to understand what drugs that we can crush for tube administrations, intravenous rates of infusions and incompatibilities that can exist. And then at times there's also a need for direct central nervous system installation of agents, and our need to assess the product for suitability and safety for this type of administration. We also do a lot of effectiveness and safety monitoring to ensure that we have adequate effectiveness and lack of therapeutic failure. And also adverse drug events, and making sure that we're preventing and managing and understanding that there may be some unsafe medications for certain patient groups, and we have to be hyper alert to hypersensitivity reactions. So there's a lot of different interventions that we make on a daily basis across this care continuum when we care for patients in coma. As I talked about before, in 2018, the Neurocritical Care Society published standards for neurologic critical care units, where it was recommended that pharmacists were essential members of this care team. They recommended that pharmacists needed to be dedicated member of this team. They need to engage in clinical daily activity with daily medication review and attend all in-hospital emergencies. They also indicated that pharmacists should play a key role in quality improvement, also in education and providing education around neuropharmacology, particularly to other caregivers. And then we have to maintain our expertise and have adequate training to serve all these roles and be able to do the roles that we talked about in identifying, preventing, and managing medication therapy problems. So, what's the future role of pharmacists? As Abraham Lincoln said, the best way to predict your future is to create it. And that's exactly what the Curing Coma campaign is designed to do, is really to create the future. When you look at what's been published to date, particularly around therapies and to restore consciousness in patients, you can see from this gap analysis and future directions, there are a lot of different roles where pharmacists can play a role in helping to close these gaps and research and identify the best types of patients that might fit the types of medications that get identified, working to develop pharmacodynamic biomarkers to absolutely understand how patients respond to drugs. Again, determining the optimal dose and timing this is such an important aspect that is critical, and pharmacists can play a key role in. And then identifying novel combination therapies. So, overall, what we're talking about here, the future is essentially precision medicine. Precision medicine gives us the promise of better understanding the complex interplay between health, disease, and drug so we can individualize care. So, what does this mean? This means the right drug to the right patient at the right dose at the right time. This is critical and this is our future. We know that response to drugs, there are many reasons and differences for how patients respond to drugs, and it's key to characterize that and understand that in these patients with altered consciousness. We need to identify patients who might receive benefit from a specific therapeutic intervention, but also we need to identify patients who could be at risk from a therapeutic intervention. This will include the identification of biomarkers that really drive forward drug selection and monitoring. We will need big data and using artificial intelligence and data sets to help us achieve this promise. And many pharmacists are also working within this big data space. And then ideally, we want to individualize the care in patients with altered consciousness. So, if I look in the crystal ball and look to the future, a future practice model for pharmacists in the future include, starting with the patient. It always is with the patient, individualizing the care of the patient. I believe it's critical that we be involved in understanding who is at risk for altered consciousness and directing our treatment to high risk patients and thinking about preventative treatments in the future. We then need to understand better these disorders of consciousness types through the use of diagnostic markers and then hopefully through drug selection biomarkers that will help us identify the right drug for the right patient. We then would have a targeted medical intervention, and this would lead us to better understand the right dose and understanding all the different things that happen to patients in the ICU that can alter medication through pharmacokinetics. And we would need pharmacodynamic response biomarkers, monitoring biomarkers, and safety biomarkers to then evaluate our therapeutic outcome and lead to optimized treatment. And again, big data and having feedback loops for data mining and machine learning models is very critical to success of this future model and role for pharmacists in the care of patients with altered consciousness. So we've covered a lot about the past, present, and future directions for pharmacists in the care of patients with altered consciousness. And I hope this just gives you a little bit of background to why pharmacists are such a critical part of the multidisciplinary care team, not only in the care of patients with altered consciousness, but also in this Curing Coma campaign efforts and in the framework that has been set forward to achieve this audacious goal. We are critical as it relates to patient care and looking at medication optimization across the continuum. Research is key, and really how it established our roles in the clinical setting is through research and developing and evaluating and closing the gaps in all the areas that have been outlined for medical intervention. Education is key. Education to healthcare team members, patients, caregivers is a really critical role of what we do on a day to day basis. And then finally, quality improvement. We must ensure safe medication practices for the care of all these patients. With this, I really thank you for listening to the roles of pharmacists in the care of patients with altered consciousness and also for your support in the Curing Coma campaign. Thank you very much.